Well, good evening, everyone. My name is Tomas Torices. I'm the chapter executive director, and I would like to welcome you and thank you for attending today's program. Today's webinar is presented by the California Chapter 2 of the American Academy of Pediatrics and made possible by a generous grant from the American Academy of Pediatrics and Project First Line of the CDC. To introduce the program and our speaker, I will be introducing the host for the evening, Dr. Ken Zangwill. Dr. Zangwill is professor of pediatrics at the David Geffen School of Medicine at UCLA and chief of the Division of the Pediatric Infectious Diseases and director of Infection Prevention Control at Harbor UCLA Medical Center in Los Angeles. Dr. Zangwill is also the Infection Prevention Control Ambassador for the AAP California Chapter 2. Please welcome your host, Dr. Ken Zangwill.
Thanks very much, Tomas. I want to be brief because the main event here is Dr. Allison Messina, so it's my job to introduce her, and it's my pleasure to do so. I met Allison actually through the Ambassador program, which was great. Allison is in Florida. She is in, whoops, I lost something here. She's in St. Petersburg, Florida. And she's the medical director of infection prevention and control there. She's the chief of pediatric infectious disease there, and she's also vice chief of their medical staff. So she has lots of hats. I'm guessing, Allison, you have to report sort of to yourself. I'm just going to guess. She went to med school at Vanderbilt, residency and fellowship at UT Southwestern, and she was a staff pediatrician there for a bit as well. She does a lot of clinical work. I'm not going to detail that in the inpatient and outpatient settings, and she teaches locally and regionally throughout Florida. Germane to this meeting, I want to just focus on the fact that Allison has gotten lots of awards in her whole career, really. She is from Hopkins, and she in stewardship and service and quality improvement and safety, and most recently as the Johns Hopkins School of Medicine Physician of the Year at her hospital in Florida. She's a medical advisor to Pinellas County School System, which is particularly germane, of course, to what we're going to be talking about today, which is all about trying to integrate our jobs as pediatricians and other healthcare providers with the schools. Lots and lots and lots of presentations or consultancies to schools in Pinellas County in Florida and St. Petersburg and health departments. She's done almost 130 different public outreach presentations in the media or interviews as a subject matter expert over the last few years. She really, in my mind, seems to be the go-to pediatric person, I think, in Florida with regards to COVID and flu and RSV and Mpox and lots of other things. So I'm going to stop talking because it's important for us to get started with the person who you came to see. So Allison, please take it away.
Hello. Hi, California. It's earlier there than it is here. I'm way past my bedtime, but it's great to be here. So I'm going to start sharing my slides. And if you can tell me if you can see them. Is everybody seeing what I'm seeing? Awesome. All right, so today we're going to talk a little bit about infection prevention in schools and daycares and how pediatricians are sort of an untapped, valuable, and desired partner. And this is something that I learned about really through COVID, but let's go on a little tour of my life for the past 3 years or so. And let's see if I can advance my slides. For some reason, my slides are not advancing. There we go. Okay, so our learning objectives for this lecture will be to discuss how pediatric providers can assist schools and daycares on infection prevention needs. We'll talk a little bit about how pediatricians might help schools and daycares work with parents on infection prevention issues. And then to appreciate how pediatric partners assisted with COVID-19 issues over the past 3 years. So first of all, why is it important that we are partners with schools and daycares in infection prevention? Well, basically because this is where schools and daycares are where a lot of our population spends a good deal of time. For example, greater than 90% of 5-year-olds are enrolled in schools. And if you look at US Census data in the fall of 2021, we had about almost 50 million children attend public schools, grade 3, pre-K through 12, and another about 5 million kids in private schools, grades pre-K through 12. And if you think about community epidemiology, school-age kids play a huge role in disease dynamics throughout the community. For example, particularly with very contagious respiratory illnesses like COVID, like flu, these diseases incubate in schools and daycares, and they spill out into the population. Kids are part of our population. They're real good at spreading germs. And so it's really important to pay attention to schools and daycares as spreaders of disease. Slides are not advancing very quickly. There we go. So when I first started interfacing with schools and daycares and school administrations, it became very apparent to me that we had to have a conversation about infection prevention that brought things really back to basics, because, you know, school administrators mostly, they spend their day thinking about education, not disease spread. You know, that's what we do in hospitals and in clinic settings. But that's really something that you know, that schools and school administrators don't think about very often. And so we really had to bring it back to the basics. And infection prevention, to me, when you bring it back to the basics, really is all about the chain of infection. And the chain of infection is really 6 scenarios that have to happen for a disease to spread from one person to another. And basically those scenarios are: number 1, you have to have a pathogenic microorganism. You need a reservoir for that organism to germinate. You need a means of escape, a mode of transmission, a means of entry into another host, and you need that host to be susceptible. And infection prevention is really the science of breaking any one of these links of the chain, because if you break any one of these links, an infection cannot spread. So if we first talk about pathogenic organisms, especially in schools and daycares, we're basically talking about viruses and bacteria. Certainly pathogenic organisms can be other things like parasites and things like that. But when we talk about the bulk of the spread in daycares and schools, we're really talking about viruses and bacteria, and really mostly viruses. When we consider the other links of the chain, we have, for example, a reservoir. So in this picture, we see the reservoir being perhaps the upper airway of a 5-year-old child. That's where, you know, RSV and flu can incubate. Means of escape might be a cough or a sneeze. The mode of transmission in this picture might be the child's unwashed hands after he rubs his nose. And then we have another picture showing means of entry. So in this picture, means of entry might be this young lady who's you know, touched a surface on a subway and then touched her nose or touched her mouth, and that's how it enters her body. And in this situation, she may be a susceptible host. Whatever organism that she just inoculated herself with may be something that she is susceptible to. And that's how the diseases spread from one person or one surface to another. I'm trying to get my slides to advance. There we go. All right, so schools and daycares are very fertile ground for germs. Why is that so? Well, schools and daycares are congregate settings. So there are places where kids interact with each other for many hours a day in very tight quarters. There's lots of shared spaces, lots of shared items. And kids in schools and daycares are different ages and different developmental stages. And that's important because, especially with younger children, they're very efficient disease spreaders. They're not at a developmental age where they really understand how important it is to cover your cough or wash your hands, or, as you can see in this picture, to run around school with a runny nose and Cheerios stuck to your boogers. This is a HIPAA compliant photo, by the way. This is my son when he was 2. So anyway, this just goes to demonstrate the challenges that we face when dealing with you know, young children spreading their germs. So the next few slides, I want to talk about 6 key areas that I think are very important, and really where pediatricians and pediatric practitioners in general can really have an impact with our schools and daycare partners in prevention of illnesses. The first one is prevention of illnesses from ever even entering schools and daycares. And what we'll talk about here is our role in vaccinating our students and vaccinating staff, and encouraging them to stay home when sick and giving them guidance as when it's safe to return. The next thing we'll talk about is hand hygiene. We'll talk about hand washing, using hand sanitizer, correct ways to do so, and the correct times to do so. And then next we'll touch a little bit on cleaning and disinfection. Finally, we'll talk briefly about food safety and the safe storage and labeling of food. We'll talk a little bit about reporting of infectious diseases and how to interface with our public health departments. And then lastly, I want to talk a little bit about education in the context of my experience with COVID-19 and the school systems. So first, let's talk about prevention of illnesses entering schools and daycares. And again, we'll talk about vaccination, staying home when sick, and communication and support of school nurses and school administrators. So I probably don't have to convince this group the importance of vaccinations. So with vaccinations, we're really talking about that link in the chain where we're talking about pathogenic organisms and susceptible hosts. A well-vaccinated population is not going to introduce a disease into a school or daycare because the disease will not be introduced in a host that is not susceptible to begin with. So I pulled up here the 2023 vaccine schedule, which I'm sure all of you have seen from the CDC website. And just to make the note that school vaccine requirements may not actually be as extensive as what the AAP and the ACIP recommend. For example, in the state of Florida, flu vaccine is not mandatory to go to school, nor is COVID-19 vaccine. It doesn't mean they're not a good idea, and it doesn't mean that these aren't things that you want to talk to your families about. Especially in this day and age when vaccine hesitancy is really an issue, and when a lot of kids are under-vaccinated because of the COVID pandemic, I think it's even more important to educate families and parents on why we give these vaccines, why we give these certain vaccines, and the diseases that they prevent. And to that end, the CDC has a really nice chart. It's relatively recently made this chart, which I think is super helpful, that is available at the link below on the CDC site. And this chart is super helpful to me because it actually outlines the disease that we're trying to vaccinate for, the vaccines which prevent that disease, and they even group them by color, like for example, the diphtheria, pertussis, and tetanus vaccine, which is one vaccine, obviously, is all in purple. The MMR vaccine is all in green, so it's very easy to follow. It also shows you each disease, how it's spread. For example, this is a chart that you can use to explain to parents how hepatitis B is spread by blood and body fluids, how H flu is spread by contact or airborne, and then it shows the disease symptoms and the disease complications. I really like this chart, especially because it really brings to light, especially diseases that parents might not know a lot about. For example, diphtheria. I don't even think my residents really know what diphtheria is, but this chart very much brings to light why it's important, why these diseases are serious, and why these vaccines are important in prevention. So the other thing when we talk about vaccines and getting especially the vaccine hesitant parents on board, anecdotes are actually very useful. And we're all taught as physicians and physician scientists that anecdotes do not equal data, and you certainly shouldn't make policy based upon anecdotes. But the experts in communication will tell us that anecdotes are actually very powerful when you're trying one-on-one to convince someone that something may be a good idea for their patient, like a vaccine. The anecdotes that I love to use are my own vaccine records. So what you're looking at in this slides are literally legit my own vaccine records. And I will bring these out, and actually we'll bring out my children's vaccine records too, because they're a little more recent than mine, to talk to parents about the importance of vaccines. And I'll share with you briefly a story because I think it's kind of funny, but it actually talked to one parent maybe about, I don't know, 7 or 8 years ago, a dad who was very hesitant about giving his son a measles vaccine. And he was worried about, because he'd heard things about autism, and clearly that was something he wanted to avoid. And he said to me, how do I know this vaccine is safe? kids had been around for a long time. And I was able to show him my vaccine records and take him to my measles vaccine, which was given to me on December 10th of 1973. So I'm telling you guys how old I am here. And it was really kind of a funny story because this was a gentleman, he was kind of a millennial sort of guy, and he was wearing a Pink Floyd shirt and it had the Dark Side of the Moon logo on it. And I was able to tell to him that I got the measles vaccine the same year that Dark Side of the Moon came out. And he kind of laughed and he was like, well, I guess, that's been around for a little while. And he actually did, agree to get his child vaccinated because of that anecdote. So it was that's why I kind of bring to light these stories because, although they're kind of silly, it really makes a difference in how you talk to your parents and how you communicate with people. So when should I stay home after I have an illness? I actually pirated this from Akron Children's Hospital. You can see the link at the bottom. I think this poster is great. I have copies of it. I go over this with school administrators and with parents, and it's a great little like emoji-based poster that shows parents like when your child has these symptoms, what they are, how long they should stay out of school, and when they are ready to go back. And it's a nice little handy chart to begin that kind of conversation. Because I think a lot of parents really do want to do the right thing when their child is sick. They really don't want to send them back to school too early, but they need some guidance there. And this chart I thought is a great way to do it. So moving on to hand hygiene. So what can we do as pediatricians to really kind of inform our patients and families about hand hygiene? Well, one thing I want to say is even throughout the COVID pandemic, although there was a lot of controversy, like with masks and with vaccination, hand hygiene was something that I never really had any problem talking to parents about. Everybody was pretty much on board with wash your hands. But the thing that they didn't necessarily know was how to wash hands and when to wash hands. And so I think this is something that we can very easily educate our patients and school administrators on. For example, when you go and see a patient in the clinic, you're washing your hands. Show the patients that you're washing your hands, demonstrate doing it, and talk through it. So I'm washing my hands. I'm going to wash my hands for, you'll notice that I'm going to wash my hands for 20 seconds, and I'll show you that I'm going to cover my fingertips. I'm going to make sure that my thumbs are clean. I'm going to make sure that the tops of my hands are clean, etc. This is something that's really easy to do because you do it anyway when you see your patients. And then, of course, we'll go into educating on when to wash their hands. For example, I think most people know to wash your hands after using the bathroom, but how many kids know, for example, that you really should wash your hands after coughing or blowing your nose or something like that? The CDC, again, has some really great classroom posters on when to wash your hands, and I put the links over here. I love this one that's actually Wash Your Paws, that talks about washing your hands after playing with class pets, which is pretty cool. And then this poster that shows kids very, very easily, all the moments when it's important to wash hands at school. So these are some hand hygiene posters that are available through the World Health Organization. These are a little bit more detailed and probably not quite as appropriate for young kids, but they're great for sort of a train the trainer type purpose. So the one on the left shows hand hygiene technique with soap and water. And the other one on the right shows hand hygiene technique with alcohol-based formula. And as you can see, it shows you sort of the maneuvers to make sure that when you wash your hands, you've covered all surfaces, including the most frequently missed areas of the hands that people typically miss when they wash their hands. So the fingertips and the thumbs being the culprits that are the most frequently missed. But if you follow those WHO instructions, you'll get all of these areas every time. And then here's a little fun experiment to do. So this is actually my experiment. These were my hands, my pictures, and my Petri dishes. So what I did here was I took a picture of 2 blood agar plates that I touched with my hands before washing them. And as you can see, there's a bunch of bacillus and coag-negative staph colonies on these plates. And then you can see the same experiment that I did after washing my hands for 20 seconds with with a disinfecting soap. The one that we use in our hospital is a 0.7% BZK soap. And you can see I contacted the plates again, and almost all of the bacteria are gone. I did the same experiment after using just an alcohol hand rub, 70% ethanol containing hand rub, did the same thing. You can see the organisms on the plate before I wash my hands and then after, and pretty much all of them are gone. And then just for good measure, and because everybody asked, I swabbed my cell phone screen before disinfecting the cell phone, and you can see the wide variety of organisms that grew after that, including those little golden Staph aureus colonies that you see. I don't have an after picture of after I sanitized my phone, but believe me, there were no organisms on it after sanitizing my phone with some alcohol. So there you go. And that leads into our conversation about cleaning and disinfection. So another thing that we can do another thing that I had to do when talking with schools and daycares about cleaning and disinfection of surfaces, where the first thing I wanted to talk about to them was identifying what needs to be cleaned. So identifying those frequently touched and frequently dirty surfaces that really we need to bring to your attention as something that needs to be cleaned frequently. So these are things like changing tables in daycares, doorknobs, shared items, etc. The other thing to do is to encourage the use of toys and items which can be easily cleaned. And this is true for waiting rooms, daycares, etc. And I got a real education about this when I was asked to train some volunteers in my hospital about how to clean toys. And I had never really done this at large scale before, but oh my gosh, there are some toys that have a ton of surface area that take forever to clean. And it just kind of got me to thinking, if it were my job to order toys for a daycare, I would be very specific about the type of toys that I ordered, thinking about how difficult they are to clean. So the easiest toys to clean have have little surface area, so they're easy to, they're not plush toys, very hard surfaces that you can easily clean with disinfecting wipes, etc. I also educate parents sometimes on the proper cleaning of products, but I think for home use, it is also important to educate parents about how germs are most efficiently spread and how they're not spread. And for some reason, I have this conversation over and over again with parents of patients who have MRSA, like skin abscesses and skin boils. For some reason, this really gets people's attention. And I've had so many people ask me, so many parents ask me, do I need to get rid of my couch? Do I need to get rid of the rugs? Well, probably not. So it's very, most likely not. It's really important to even educate parents on home cleaning, to really concentrate on the things that are high touch surfaces and by far hand washing. So let's talk next about, when we talk about cleaning and disinfection, there's kind of two things to talk about in the home and school environment, and that's sanitizing versus disinfecting. So sanitizing is where you reduce pathogens to a safe level. And this can be used for food items, toys, pacifiers, etc. A good example of a sanitizing device that most of us have in our homes are a dishwasher. Dilute bleach solutions can also sanitize things like in the kitchen, sanitize things in daycares and schools like pacifiers, toys, etc. Disinfecting takes it to slightly a different level. Disinfecting is where you use agents that eliminate or inactivate germs. And disinfecting can be used on sort of your dirtier or germier surfaces, like diapers, changing tables, sinks, bathrooms, etc. And some examples of some disinfecting products, things that you can easily find on the shelf, are things like quaternary ammonia compounds, Lysol is an example of that, or more concentrated products like bleach solutions, bleach cleansers. In terms of disinfectants, it's important to know that all disinfectants that are sold in the United States are regulated by the EPA, or the Environmental Protection Agency. And all labels on all products that we buy at the store have to have labels that by law contain certain pieces of information. Things like active ingredients, their EPA registration number, directions for use, cautions and precautions on what to do if these agents, which are sometimes caustic, contact the skin or the mucous membranes. There's some first aid information that has to be there, and storage and disposal. But one of the things I really want to point out, because it is important, is contact time. So the contact time is also listed on every bottle of disinfectant that you buy. And the contact time is basically how long does the surface have to stay wet with this disinfectant in order for it to kill germs. And this was something I did not myself pay all that much attention to before I started doing infection prevention. But contact times are really important. So when you spray a surface with a disinfectant, you can't just immediately wipe it up. It doesn't kill germs immediately. Different products have different times that they have to lay dormant in order to do their job. Now, in our hospital, probably like a lot of hospitals or clinics that you work in, we have a variety of cleaning products for a variety of different purposes and surfaces. And so in my hospital, the contact time we felt was so important that we actually put little tags with contact times on each of the different products that we use. Just so that people know, and it's right up in front of their face so they don't have to read the tiny print on the labels to know how long to use these products before they're doing their jobs. So then we'll talk just a little bit about food safety. And this is important in schools and daycares, obviously, and even in the homes. We'll talk briefly about the food safety concepts like the food danger zone. The food danger zone is a range of temperatures from 40 degrees to 140 degrees Fahrenheit, where bacteria and viruses can sort of replicate in foods. So you want to keep, this is the concept of keeping cold foods cold and hot foods hot. So you want to make sure that foods do not spend a lot of time between 40 and 140 degrees Fahrenheit, because that's when foods kind of spoil. The other thing too that is also very important, particularly in daycares, is the proper labeling of food. Because, for example, in the hospital, when we have stored breast milk in our freezers, it is a huge deal if a baby gets fed the wrong breast milk from the wrong mother, right? Because then you have a big risk management situation. I have to be called in and we have to test the donor breast milk, and, the donor mother who inadvertently may have given the breast milk to a baby that wasn't hers. But this happens in daycares too. And I think that you have to have, if you're advising a school about proper labeling of food, things like that are very important to make sure that there's not a mix-up. Hand hygiene before and after eating or before and after food prep is also very important. And just to be aware that there is a site on the CDC website called FoodNet that alerts people to foodborne illnesses or outbreaks of certain organisms that grow in food, like for instance, listeria in ice cream or salmonella in peanut butter, etc. So just to be aware that those things are there for your education, and to make sure that we are keeping our food supply safe for our kids. Some other resources that I have found really helpful in terms of food safety, there is a publication called foodsafety.gov that has a bunch of very cool little posters that you can hang up or print out for your schools, daycares, and even your hospitals that talk about food safety for young children. There's also a very cool preventative health and safety in the child care setting booklet that was produced by the nursing department at UCSF that has a bunch of really helpful information about keeping kids healthy from infections in child care settings. And it's a free download. I found it on the internet and I have it on my computer. It's really, really helpful. And the link is there at the bottom of my slide. So finally, I'm just going to talk a very little bit about reporting of conditions to your local health.
Allison, I think you
And
froze
sort of
there.
what our roles and responsibilities are as pediatric healthcare providers. And, oh, I'm sorry. All right, am I back? I can't really tell.
You froze for 2 seconds. You're back now. You're good.
Oh, okay. All right, cool. So anyway, let's talk about reporting. So there's a group of, there's reportable conditions and there's notifiable conditions. And reportable conditions or diseases are really a set of diseases or conditions that each state or each territory has local laws set around reporting rules for them. So these can be found on your local state health department websites. These are conditions for which the local health departments want healthcare professionals, laboratories, hospitals, and other public health personnel to report to the local health department when they see them. So after these get reported, the public health departments will collect information about that patient and how they became ill. And then that information is used for the health department to locate that source and maybe do contact traces around that source to identify people who might have been exposed. The list of these conditions can change each year. Now, the notifiable diseases are sort of a national set of diseases set by the Council of State and Territorial Epidemiologists and the CDC. There are about 120 or so conditions. They may change every year, but change a little bit every year. And these are a list of notifiable conditions that the CDC wants the local health departments to report to them about. So I keep a very, this is California's from the California Department of Health website, the list of reportable conditions that they want to hear about in California. And I'll tell you that the list looks very similar in Florida. Every state health department has these. And these little conditions, I keep this kind of tacked up in my office, but they're super helpful because they not only tell you which diseases they want to hear about, they also tell you on the basis of these little icons how soon they want to hear about it. So for example, some of them are very immediately reported. They want you to call a 24-hour hotline, for example, if you find a case of anthrax or you find a case of brucellosis, et cetera. But there are some that they give you a little bit more time in reporting, some of the other conditions that aren't quite as contagious or quite as dangerous that they give you a little more time with. But this is very important to know that these exist so that you can report them when you see them. If you work in a hospital system like mine, a lot of times our infection prevention nurses will do this for us, but it's important to know that they're there. It's also important when I talk to residents and trainees, because sometimes they get a little bit confused. They get very, very nervous when they see a patient, let's say, with tuberculosis, and my residents ask me questions like, oh my gosh, do I have to notify the school? And I have to remind them that notifying other people beyond that source case, that's really the health department's job. And what your job is to report the case that you know about, and then the health department sort of take it from there. So important to know kind of how that works and where to find these resources. I don't have this chart committed to memory myself, but it's good to know that it exists and where to find it. All right, so now I'm going to take a little bit of a pause and talk to you about sort of my role in educating schools in the Pinellas County area, specifically with relation to COVID-19. Before I kind of, go into the nitty gritty of what we did and how we did it, I just want to share with you just sort of my experience and how this came to pass. So I live in Pinellas County, Florida, and in the city of St. Petersburg, and I've been here since 2006. And in that time, I never really interfaced with the schools. They never asked. I never really thought about it, to be perfectly honest with you. It never kind of came up until March of 2020. This is when obviously we were inundated with cases of COVID-19. In Florida, at least, March is when we have spring break. And the experience that we had in our community was that the kids went on spring break in March and that year of 2020, and they did not go back to school after spring break. Everything went online after that. And at the time, I had 2 children myself in Pinellas County schools, and I have a stepdaughter who was in a private school in St. Petersburg, and all of our kids, just like everybody else's kids, were home. And it was also during this time where I was, very busy, as the head of infection prevention with my hospital, trying to develop, plans for surges and what were we going to do about, PPE. And, we were in the middle of this hot mess with COVID, as you all were. And I get a call. My administrative assistant pages me in the middle of the day and says, "Hey, I've got the Pinellas County superintendent on the phone, and he wants to talk to you." And so, you don't say no. And what he basically said, he said, "Hey, this is Mike, and I'm the superintendent of schools in Pinellas, and we're working, we're going to close schools for the rest of the year, but I really need your help for what about when they return? And we don't have any idea in the school, health system how to, try to prevent the spread of this very contagious disease." And so, so that was sort of my introduction to working with the Pinellas County Schools. So just to give you kind of an idea of the scope of what we're talking about, Pinellas County school system is pretty big. It's probably not as big as Los Angeles, but I think it's the 20th largest school system in the country, representing about 109,000 students and about 15,000 staff. And you can see the demographics, pre-K all the way through adult education. And so it was a huge lift. I mean, there's a lot of lives we're talking about. So after that, so I'm just trying to wrap my head around that. And the very next day, I get a call from the headmaster of Shorecrest Preparatory School, which is where my stepdaughter went to school at the time. And this is a pre-K to 12 school that has about 1,000 students, so a lot smaller than the county of Pinellas, but they were basically asking me the same questions. How do we safely get kids back to school when, and how do we know when they can go back? So all of a sudden, I was kind of thrust into this role where I had only ever done infection prevention at hospital level. I had no idea how to do this in schools. And so that was sort of toss me into the mix and try to figure out how to do this. So with the Pinellas County Schools, we kind of got together, me, the superintendent, various school officials, school nursing leadership, community pediatricians, school principals, etc. And the first thing we did was we had several meetings that just were based upon education. What did they need to know? What did I need to know? And what could I, sort of give them a crash course in virology, in infection prevention, in what we knew about COVID-19 at the time. So we kind of went back and forth with a few meetings and sort of, gathered the common questions that people wanted to know. And then the superintendent asked me, he said, "You know what, this is really good information. I think we really want our families to know about this. So Dr. Messina, can you record an educational video that we will put up on the Pinellas County School website so that, we can direct people to if they want to know a little bit more about this?" So I did, with the help of my media team at the hospital. I recorded a video. It was about 30-minute long video that was uploaded onto the Pinellas County site and broadcast all over the county. And I just want to tell you, if you want to become really popular with your own high school age kids, be the face of infection prevention for the entire county. They were super glad, let me tell you, that their mom was all over everything in Pinellas County Schools. I made them really, really cool. I jest. The other thing that I helped them do was make COVID-19 content for the Pinellas County School website. So there was a frequently asked questions section that I helped write and I helped edit so that they could have, real accurate information for the families who visited their site. So after we did sort of that education piece and kind of getting everybody on the same page, that's when we really started the policy making. And here it was really, really important to have the right stakeholders and the right decision makers at the table. So the superintendent, the vice superintendent, the school nursing leadership, the director of the county health department was also involved in our meetings, the director of our community pediatrics programs, several private pediatricians from the community, and also the director of school facilities. The people that were in charge of the ventilation and the HVAC were also part of our team. And we set policies for school masking, hand hygiene, how to report cases, contact tracing, school hygiene, industrial hygiene, ventilation, etc. Then we met monthly and then ad hoc with school leadership. And this included site visits to various schools. So I toured several elementary schools, several middle schools, high schools. We even took a tour of the school buses and the school bus depot to talk about how they were cleaned, and when we visited the schools, how we could keep kids 6 feet apart, how we could do lunch, having kids eat lunch outside, should we have them eat lunch inside, et cetera, et cetera. We really went into all of these, all of these buildings and made plans with their actual teachers and their actual principals, and it was actually pretty cool. I learned a ton. And then finally, we kind of leveraged their communications team and did spots on TV, did spots on the news, and again created more and more content for their websites. And to make sure that people were up to speed and they had good places to go for accurate information. So in the private school, we did things pretty much the same. I actually kind of worked more initially with the public schools and kind of took that kind of learning on the go, just took kind of what we learned and what worked in the public schools and brought it over to the private schools. We did education there too. We started with education, meeting with the headmasters, school nurse, board of trustees. And then in the private schools, we had a very early on in the pandemic, we had a town hall meeting that they did over Zoom, that anybody from the school could attend. So parents, teachers, students, etc. And it was panel style. So I was one panelist, the headmaster was a panelist, the school nurse, etc. And we just fielded for about 2 hours, questions from parents, teachers, students. It was actually really cool. It was a little nerve-wracking. I don't think I've ever been so nervous in my life, but it really went off very well and answered a lot of questions in a really short period of time. And it was interesting because a lot of the parents of students in that meeting were also my colleagues at work, which was kind of a weird dynamic, but it worked out quite nicely. And policy making in the private schools, a little bit different, but similar. It's a smaller school. The stakeholders were similar at these meetings: the headmasters, school directors, directors of facility, athletic directors, school nurse, etc. And again, we set policies for their masking, hand hygiene, reporting, and as such. And we had actually weekly Zoom meetings with my private school partners for about 1.5 years. Actually, this went on for a long time. And just to make sure that they were doing everything correctly and they were doing all they could do to keep their kids safe. I helped them with their website too. We did newsletters at the private school, and I helped their school nurse with email communications, because their poor school nurse, everything was up to her in terms of, communicating with the families about contact tracing and things like that. And so I was able to work with her and create some kind of form letters that we could send and just kind of modify to send to the individual parents and students. So that was really helpful. Really helpful to her. She worked very hard during the pandemic. So lessons learned. So there were some challenges. And they were the challenges were a little different working with the private schools versus working with the public schools. With the public school, the biggest challenge, I think, was scale. We're talking about over 100,000 students, 15,000 staff. So I would say that when dealing with public schools, your biggest ally is going to be the Department of Health, because they have the resources to do contact tracing, to do testing in some cases, that we couldn't do just sort of by ourselves. There's just too many people. The other thing that was brought to light that I probably overlooked, quite honestly, and this is something that the pediatricians were so helpful with, they brought to light the particular challenges with underserved populations. So students experiencing homelessness, health access issues. For example, it's really easy to say, well, if your child is sick, you need to go to the pediatrician and get a test. Well, what if that child is experiencing homelessness and they don't really have a place to go, or they have transportation issues? So we had to work with the community health resources to bring some of that stuff into the schools, because for a lot of kids, really the school environment is not just where they learn, but it's where they get their medical care, it's where they get their food, it's really where they get a lot of support. And so we really had to pay attention to those communities, because they had particular needs that we had to pay attention to. The other challenge, I don't know if this was as great a challenge in California as it was in Florida, but political issues were huge. So at first, people were generally kind of on board with masks because it got kids back to school and they just wanted them to be back to school and not at home learning anymore. But very soon people got very tired of wearing masks, and I could not believe how heated this got. I was asked to go to a few school board meetings, and I think I still have post-traumatic stress from some of those meetings. People were very vocal on both sides about wanting the kids to wear masks versus masks harm children, and you guys are child abusers, and it was nuts. It was something I did not entirely anticipate, but that was a challenge. In the private school.
Sorry to interrupt. Pardon me for
Okay.
interrupting. Just want to let you know we have about 10 minutes left.
Okay.
I want to leave a tiny bit of time for questions, so just let you know.
Okay, perfect. I think I only have one more slide left. In the private schools, the challenges were a little different, and a lot of it was kind of financial. So the private schools generally tended to be a little more cautious about wanting children to go back to school, but at the same time, they had to be very cognizant that parents were paying a lot of money for their kids to go to private schools, and a lot of parents really wanted them back because it was costing them a ton of money for this education. So the things that work well, again, partnering with the Department of Health, they have the resources, they can do contact tracing, they have communications, infrastructure that we tapped into. Partnering with trustees and superintendents is also hugely helpful when dealing with schools, because these are the people that can make things happen. And then, of course, partnering with community pediatricians. They were super great about extending after hours visits, setting up community testing sites, and things like that. And we really could not have gotten kids back to school safely without them. So the other thing that worked well was virtual town halls. We did them at the private school very early on, and then very soon on, ABC Action News in our area liked this idea so much that they did a Facebook Live kind of town hall where basically anybody with Facebook could log on to and talk to me. I'm there, as well as some of my other pediatricians in the area. And then visiting with individual schools, speaking with the teachers, speaking with facilities, particularly speaking with school nurses, was also quite helpful and quite an eye-opener to me, someone who had really never left the hospital environment doing this kind of stuff. So, and I think that's it. So I hope we have at least a few more minutes for questions, but I will take anybody's questions.
Well, thank you very much, Allison. First of all, a lot of useful information there. Let me say that. There's a specific question in chat from Marianne Feinerman. How safe are books and magazines, and if they need to be disinfected? And Marianne, if you want to amplify that question, unmute and please do so. But that was the specific question I'll put to you.
Yeah, so that's actually a really good question, and we had this issue in our hospital actually pre-pandemic. We had like a joint commission visit, and they actually kind of got on us about books and magazines, about they really can't be easily disinfected because they're paper, and you can't really wipe those surfaces. So what we ended up doing in the hospital was getting those sort of board books that were kind of glossy and easier to disinfect. That's not really, you can't really do that as well in schools. I think in a school setting, we have to recognize it is a little bit different than a hospital, and that these are not necessarily super vulnerable populations. Like, it's different when you're disinfecting something in a HEMONC unit versus when you're disinfecting something in a 5th grade classroom. I think in the schools, sharing books is probably okay. I think hand washing is the big thing after that. If you're going to share a common book or you're going to share common items, it's not so much in the schools about disinfecting those individual items, but washing your hands after you touch them, or sanitizing your hands after you touch them.
Very practical advice.
Yeah.
First of all, you might want to unshare in case anybody wants to video themselves.
Oh, yeah. Okay.
So you mentioned at the end and throughout a little bit, obviously, the role of the pediatricians. We have a lot of pediatric providers here. We have a lot of school people here who are not pediatricians. I would just throw out there, if anybody was on a task force or of any of that sort of thing, to share verbally or in chat your experiences with that. I think that might be helpful, number one. And I would ask you, Allison, when you were on these task force and a different breadth of types of schools in the county and private and whatnot, I'm curious what schools might have been most interested in And you mentioned a few things, but did that jive with what you thought was most interesting, what was most important for schools to know? Because if pediatricians and other folks are going to reach out to schools to try to help, I want to probe if was some sort of disconnect there in terms of what they thought was useful and important and what you thought was useful and important as we move forward trying to help these folks.
Yeah, I think that's actually really important. One of the things that the schools really, especially as testing became a little bit more available, one of the things that the schools really found helpful was remember their goal was to get kids back to school as soon as possible. So if a kid had a runny nose early on in the pandemic, you had to get a test to make sure that that kid either had COVID or didn't. And this was very important to the schools. So what they wanted to know was, where could our kids get tested the quickest? We want to know right away, right? And so, you know, in the hospital where I work, I mean, that's easy. You just send them to the lab and you get the test and it's back in 20 minutes or so. But in schools, they really wanted to know who can do the testing, how fast can you get it to us? And especially again, early on in the pandemic, you were kind of limited in the testing that you had. And so that's where our pediatric partners in the community really stepped up and helped the schools, because they said, you know what, we'll open our clinic. If one of our patients needs to be tested, you just send them over, you don't need an appointment 3 days ahead of time. Just let us know they're coming. We'll test them in the car. We'll get that result and we'll get it back to you. So, I mean, like things like that were super important to the schools and were easy for me to do in a hospital setting, but really difficult in a school setting. So that was key.
So Laura Aguilera asked the question, can you please review the current symptoms for COVID? Because it often might look like allergies and other things. Is there anything that helps you in that regard?
Yeah, I mean, we talked a lot about that too. And of course, as we moved even from one like COVID variant to another, those things changed, right? Like at first we were telling people, look out for loss of taste and smell. And then as we moved into like Omicron, that wasn't really much of a symptom anymore. And then now it was just like a common cold. So I think that, the symptoms have changed over time. Right now, I would say I would struggle to know if a person has COVID or a common cold. Because right now, the variants that we're seeing are just for a lot of people, especially people who have been vaccinated and especially people who have had COVID in the past, it really does look like a common cold. I don't know really how to tell you, what it looks like without testing. It's really hard for even me to tell.
Fair enough.
But,
Fair enough.
But earlier on, yeah, that was a challenge.
So so COVID is waning, let's put it that way. And what can pediatricians or other folks do now that where COVID isn't isn't in everyone's face, as it were? How can pediatricians get really involved now with schools or daycares in the whole realm of infection prevention? There's subject matter experts such as yourself, and then there are folks who are pediatricians who may not be subject matter experts in virology or something. How can they reach out tomorrow? And what services can they provide in the infection prevention, logistical implementation, family education, staff education realm that might be useful now? Sure.
Well, I think that first of all, we need to seize upon this opportunity because we have a captive audience right now. All the schools and daycares are right now experiencing post-traumatic stress from COVID-19, right? So you have a captive audience right now. So I think you can sort of capitalize on that and say, hey, look at what we went through. And this is why, a great example of why infection prevention is important. And I really think that it goes back to those first few slides that I was talking about, understanding why immunizations are important, why hand washing is really important. That chart I showed about when to stay home, like what conditions that a child might have that should keep them out of daycare, and when it is safe to go back. Those things are very important too, so that people aren't sending kids to school that are sick. Oh, well, it's just allergies, but really it could be adenovirus, So, really those kinds of, talking to them about the things that you see in your clinic that, when I'm seeing adenovirus in a bunch of kids, maybe I want to be able to reach out to my local daycare or local school and say, hey, we're seeing this. If you start to see this, let us know, or, things like that. But really kind of going back to the basics of infection prevention, and not talking about it in terms of one disease like COVID or flu, but just respiratory diseases in general, how airborne diseases are spread, and things like that are very, I think, can be very important. And like I said, right now you have a captive audience because everybody knows how important it is because of COVID. So.
And we only have a minute or so left. There's a question from Teresa Guest. I'll quote it. It says, May 11th, CDC is making recommendations. Can you explain changes?
Sure. So what's happening on May 11th is that the federal mandate, which kind of dictated things that we had been doing during the pandemic, are going to it's going to be kind of a shift back to normal. So for example, for hospitals, this emergency mandate said that we could, reuse N95s, and now we're going to kind of go back to, no, we're going to use them like we usually did before. So that's the kind of thing that I think is going to sort of change on May 11th, is we're sort of stepping back and going sort of back to normal. With regard to masking, the CDC, what they had been saying even prior to May 11th is that when COVID, or when COVID is really high and rampant in your area, they will recommend that folks wear masks when they're in congregate settings. So right now, if you look at a map of the United States, COVID levels are pretty low, pretty much everywhere right now. But should that change, the CDC may may recommend that people wear masks again. So it's going to be kind of a more dynamic thing. Whereas before, earlier on in the pandemic, they were saying that everyone should wear a mask whenever they go out in public in a congregate setting. Now they're saying it's going to be it's almost going to be like a weather report. Like if COVID is high, then you should, think about wearing a mask. If it's low, maybe not. So it is going to be a little bit more challenging, I think, for people to keep up with. My prediction is that, honestly, in states like Florida, we're really not going to be wearing masks very much. There are going to be areas that where people are maybe a little bit more mindful, or there are going to be populations that are a little bit more mindful, like your immunocompromised populations, like people with pre-existing conditions or elderly folks who are going to want to wear masks with a little more frequently than others. So,
well, we've reached the end of the hour. Real quick, someone is asking a very California-specific question about whether testing will remain free or remain available. And there are national and regional and state-based efforts to, particularly in California, I can't speak for Florida, obviously, to provide insurance, quote unquote, or options to have those tests paid for. I am not up to date on the latest, how that might go down in California. Others on the phone or in the meeting, if you know, please share with everyone else. And maybe Allison, about that as well. That's the last question. Do you have anything to add about that, Allison?
Yeah, no, I really don't. I know that, in Florida, you can still get tested at the health department and places like that. I think that people are not getting tested very often. I will say that right now. I think that most people are, if they're experiencing symptoms, they're not necessarily getting tested.
Yeah, this is from Leticia Juarez, who works at a childcare setting.
Yeah.
So she's concerned about that, rightly
Yeah.
so. So I apologize. I don't know the specific answer to that question. I do know there's a lot of discussion in California about maintaining resources. Some of that have already been planned. I just wish I could be more specific with it, but I can't. Well, I'll let Tomas and or others close out, but I'll just thank you again, Allison. We had 62 people on this thing all night. That's great. From a sort of a wide variety, healthcare people and school people and childcare people and public, just sort of a panoply of people. So that's a great thing. And I want to thank you directly for this. And I'll turn it over maybe to William or Tomas.
Yes, thank you, Dr. Zangwill. And thank you so much, Dr. Messina, for presenting this to us tonight. Somebody had asked if the slides would become available. The recording will be available. Are you able to share the slides with the group?
Yeah, sure. Shall I send them to you?
Yes. Well, I already have them. I just
you have them. Okay. That's fine.
I just needed your permission to make sure.
Yeah, absolutely. Yeah, no problem.
Okay. And also for all of the attendees still on the call, if you have any other questions, you are free to email us directly, the chapter. Will, if you can put the email address where they can email to us, that way, if you have any questions, you can email us the concern, and we will forward that to Dr. Messina, and we'll get an answer for you if possible, or with Dr. Zangwill. I also want to say that Dr. Zangwill will be speaking at the upcoming AAP California Chapter 2 Symposium on May 20th at UCLA. His presentation is COVID related. It's the new infection prevention, pediatricians, and possibilities post-COVID-19. So Dr. Zangwill is going to be one of our speakers for the Mike Marcy lecture.
Actually, Tomas, let me interrupt, just to let people know, I'm going to be focusing on how infection prevention is going to change, and I'm going to try to de-emphasize COVID a little bit, just for information.
Excellent. Excellent.
Yeah.
Anything else you want to add, Dr. Messina?
No, thank you guys for having me. This is a really unique experience, and I love being here.
Excellent. Thanks, everyone. Thank you for attending. Have a good evening.